Good evening, everyone, and welcome to the Black Men and Mental Health webinar. I'm Christopher Marville, peer and outreach liaison for Seeds of Healing. Seeds of Healing is a HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma and generate support for marginalized people living with or affected by HIV. Today we have Tyler Bing-Lawson. Hi, Tyler.
Hey,
Tyler Bing-Lawson is a psychotherapist and clinical director at NUU Counseling Services in Raleigh, North Carolina. Hi, Mommy. He specializes in working with adolescents, young adults, LGBTQ plus, and men issues. He seeks to work with clients to create a personal change that has a positive ripple effect on their communities. How are you doing tonight, Tyler?
I'm doing great. I'm glad to be here with everybody and glad to talk a little bit about men's health and how we can connect that to mental health.
Mm. Yes, thank you so much for being here. This is people don't know there's been a lot of good work going on behind the scenes. So I'm just happy to finally have this sit down conversation with you. We really appreciate you being here.
Thank you.
Okay, cool. So do you mind if I just set the mood with like a little history behind why June is so important? Just with a little few.
Absolutely. Yeah.
Okay. So as most of you may know, June is Pride Month, but it's also Men's Mental Health Awareness. So back in June 28 of 1970, on the 1 year anniversary of Stonewall Uprising, the first Pride marches were held in New York, Los Angeles, and Chicago. Thousands of LGBT plus people gathered to commemorate Stonewall and demonstrate for equal rights. It took over 30 years for Pride Month to become official in the 1999 proclamation form from former President Clinton. Come on, President Clinton. We know Clinton. Right? Research discussed how Black LGBTQ plus individuals have higher risk for poor mental health outcomes associated with anxiety, depression, and suicide. Because of the political and social climate that continues to be hostile and violent towards Black and LGBTQ plus people, the intersections of being Black and LGBTQ plus person, particularly those of us living in the South, intersection South experience a world of discrimination differently than our white and or straight cisgender peers. And cisgender just means someone whose internal sense of gender coincides with the sex they were identified as birth. It's not a slander, it's not a slur, it's just biology. Um, yeah, persistent oppression amplifies mental health conditions for the Black LGBTQ plus individuals and experience from discrimination and harassment because of their identities. June officially was designated Men's Mental Health Awareness Month in 1994 when National Men's Health Week was signed into by President Clinton once again. Shout out to Will Queen King. And initially it was week-long observance, but it was later extended to a month-long celebration. The goal of this month is to raise awareness for men's health issues, encourage early detection and treatment for disease, and promote a healthier lifestyle. Now, speaking of all of that, Tyler, what are the priority health concerns for Black men?
Well, speaking of that, I went and found some information related to the priority health concerns. So what I found was that the Hopkins Bloomberg School of Public Health have an initiative called the Black Men's Health Project. In their initiative, they've identified that Black men have the shortest lifespan, which is on average 72 years old, of all groups by race and gender, except for Native American men. According to Ronald J. Thorpe of Johns Hopkins Center for Health Disparity Solutions, many Black men believe in health repair instead of health maintenance. What that means is that Black men are less likely to make regular trips to the doctor or discuss their health issues as they arise. Instead, Black men are more likely to show up at the ER or urgent care when their symptoms have progressed significantly. And despite the world around us changing significantly, these behaviors are generational. And what that basically means is that we've learned these behaviors from our parents, our grandparents, and so on. Some of the other top health concerns that have been identified are cancer, stroke, and heart disease. And while those may have some genetic predispositions, they're also lifestyle diseases, which means that they can greatly be reduced by lifestyle changes.
And they all seem like they were dealing with like heart and stroke and hypertension.
Yeah,
So I think there's any like connection there with men being taught to push down their emotions for so long and then it now coming up
absolutely.
where we have these.
Absolutely. Absolutely. There is a very strong link between stress and hypertension, stress and physical symptoms that we have. And you have to think that if you're experiencing stress over a chronic period of time, a long-term period of time, that will eventually affect all of the organs within your body.
Yeah,
So your blood pressure, your heart, your brain, your veins, everything.
that makes sense. That makes sense.
Mhm.
So, like with us knowing this as Black men and having this research, why do you feel like it's so still taboo? Like talking about things like these are so taboo for Black men. Why do you think, we haven't? There's been a call to action from Black men to Black men for this reason.
Yeah. So there's really three things. So the first is systemic racism. The second one is religiosity. And then the third one is criminalization of Black behavior. So I found some statistics on that as well. Um, so there have been a number of medical projects over the years that have really led to systemic racism and have led to a mistrust in medical care. One of those examples is the Tuskegee Project, which occurred from 1932 to 1972. This was a project where there were African American men who were unethically experimented on. They were denied life-saving treatment for a treatable disease. That disease was syphilis. And this was all in the name of medical advancement. Um, we also have situations where people are being misdiagnosed or underdiagnosed with medical conditions simply because their practitioners were not really listening to them, were not really taking into account what they were saying and what their concerns were. Another example that baffles me that a lot of people don't know about, but I think that's probably because some of that information has been put underneath the surface, is the forced sterilization and eugenics projects in the 1930s. So these were projects that were going on all across the United States. In North Carolina, we had a eugenics board that began in 1933. And these were publicly funded boards targeted towards poor, mentally ill, incarcerated, developmentally disabled, and people of color. And this really shocked me. According to the ACLU, 7,686 people were sterilized in North Carolina after 1933
Mm.
until it was ended. And of that, 5,000 of those individuals were Black. So these are all examples of systemic racism. So the piece about religiosity is that religion and spirituality have always been at the core of the Black experience in the United States. Religion and spirituality were a major support and way to cope with the stressors of slavery, of racism, discrimination that face Black Americans. And for this reason, prayer and faith have often been seen as treatment for mental health issues. This belief could translate into if you were unable to deal with your mental health, you were either weak or you were of little faith. And basically that you needed to pray away your mental health.
And the gay.
See, yep, yep. Um, in terms of criminalization of Black behavior, so although Black Americans only account for 13% of the adult population in the United States, Black individuals make up 33% of the sentenced prison
Mm.
population. This disparity in environment has led to Black Americans being more likely to be viewed as violent instead of mentally ill. And I think we can probably all think of examples where individuals with mental health issues called for assistance, and instead of being met with compassion and with somebody who was trained in mental health practices, people who could de-escalate situations, they were met with force and placed into the criminal system, or sometimes even worse. Sometimes it led to death. So I would say those are some of the major reasons for why it's taboo, not only to reach out for mental health care, but also to reach out for medical care.
Yeah. So will it be like also like a stigma and then just like fear for Black men because they just don't know what they're getting into if they reach out for help? Like you said earlier, they're not listened to. We're not taken serious about our
Absolutely.
oh,
Absolutely.
you got this. I've heard it. You got it, buddy. Oh, you can handle this. You're strong. And it's like, I'm
Yeah,
telling you, I'm breaking down now, and I need somebody. And it's like you get,
right,
oh, you got this. A little pat on the back. Got this.
right.
You got man
And
up. Yeah.
and I think also, yeah, yeah, man up. And then I
Hmm.
think also, as not all, not all Black men, but many Black men are taught not to express their emotions. And in fact, the only emotion that a lot of men will tell you is acceptable is anger.
Hmm.
So there's a lot of emotions that are kind of like underneath the surface that sometimes are very much like raging. And there isn't even the language to be able to tell people what is going on. So if you can't tell people what's going on verbally, you may act out what is going on
Because
through
you don't know how to properly
dysfunctioning
ask for help.
behaviors.
Yeah.
Yeah,
You don't know how to properly ask. You never been taught how to deal with that. So you don't know how to properly. You don't know those feelings are like you said. Like there's no language. I don't know what I'm feeling right now. I don't know how to describe
mhm,
anxiety. I don't know how to
yeah,
describe depression. You know, it's just like it feels
exactly.
normal. This is my normal life. I'm supposed to be depressed.
Exactly.
Yes.
Exactly.
Um. So with all that said, and you brought up how generational the things can be passed down. So do you think that trauma can also be passed down? So like the fear, like if my great grandfather was a part of the Tuskegee, excuse me, experiment, and he then was like, oh well, we don't go to doctors around here. We don't do that. We go and try to find something to fix it here, a little Epsom salt, a little onion in the salt. Is that where like maybe the home remedies came in, and maybe like
Mhm.
that like oh we got it here at the house. Put some Vicks in there. Put some Vicks on it.
So I think, yeah, so I think some of it is a reliance on we can figure out what we need to do. This is an institution that is not built to help us. That is a belief system right there. Some of the beliefs and some of the like practices that you just talked about, they're coming from other religious backgrounds. They're coming from other places. Um, I think one thing that is often thought of is that when Africans were enslaved and brought over to this country, we didn't bring anything with us, but that's not the case. We brought a
Hmm.
lot with us. So we brought a lot of practices with us. Those were later synergized with other belief systems, other religious belief systems, which some of those older indigenous African belief systems, they are still present in the way that we do things today. You spoke about like also things being passed down. So yeah, there are beliefs that are passed down. There's also a lot of like science that is being done on understanding. Um, I can never pronounce it correctly, but telemeters, and more basically looking at is there something that is stored in our genes that is passed down from one generation to the next generation. What we
Hmm.
found is, and I even learned about this in social work school, is that when a Black mother is carrying her child, she is much more likely to not be able to carry that child to term. The reason being is the stress of systemic racism, of possibly trauma.
Hmm.
And so all of those things are in her body and then are passed down to her child, which then might be passed down to the next child.
Hmm.
And we think that it might be going on for generations. So I think even the idea of why can't you get over the things from the past? It's because these things are literally following us in our DNA.
Yeah, it is. It's true. Yeah, they're going through. You can't pull up by your bootstraps if the straps are taken from you. You know, the
Mhm.
straps are gone. Yeah, that's beautiful. All right. So, what role does mental health play in the whole health? I think we talked about this a little bit earlier too.
Mhm. Mhm. Yeah, so there's obviously a connection. There's a connection between mental health and holistic health. Um, the way that I like to think about it is your mind is an organ. It's an organ, it's part of your body. So we tend to think of mental health as being something that is separate from physical health, but it's really not. If you have a if you have a leg that is broken, you'd see a doctor, or possibly a surgeon to have it fixed. When there's difficulties with the brain, who do we see? My suggestion would be mental health providers, neurologists, psychologists, psychiatrists, therapists. Um, there's a very strong mind-body connection, and after all, we store a lot of stress within parts of our body. For some people, this may be in their chest. For some people, it's in their back. For some people, it's in their neck. For some people who have digestive issues, it can be kind of in their gut and it can be in their stomach.
Mhm.
Yeah, yeah. I often will tell my patients, like, one of the things that we know about this, like, gut and brain connection is that think about all the ways that we refer to our emotions. I have a gut feeling.
Mhm.
I have butterflies in my stomach. That's really showing us there is a connection with our body and our emotions. Um, yeah.
Okay, yeah, that's good. Yeah, I do. I hold a lot of anxiety in my stomach. Like, yeah, I
Mhm.
can already feel. I'm like, oh, this doesn't feel right. Something like what
Yeah.
is it like the crawl? I feel it in my crawl or whatever that is. Like that's
Yes.
deep up
Yeah.
in
Yeah.
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 Okay, so is it possible for a man to recognize when he might be experiencing mental health challenges? Like, are there any indicators?
Absolutely.
Okay.
Absolutely. And I want to make sure that I read off some of these things so it's very clear. Yeah. So there's a number of things that we can witness for ourselves. For instance, like changes in appetite, sleep, changes in sleep, changes in energy, changes in motivation, a reduced interest in the things that we normally enjoy, a constant feeling of being on edge, irritability, increased anger, arguing more with others, especially the people who are closest to us, weight gain or weight loss, feeling more worried most days. And then sometimes we can have problems at work or at school or difficulties within our relationships. And one other piece that I think is often a sign for us is feeling disconnected from the life that we're living.
Mhm.
And so those are all symptoms for depression, for anxiety, for stress, for burnout.
So then how would I know if it was different than just my everyday, like just my little woes? Like at what point would I need to start seeking help? Like if I'm having like
Yeah.
I'm just sometimes I'm usually a sad person or I'm not like a big eater or I already don't sleep properly. What would be any like what would be like a sign that I need to like talk to somebody like immediately?
I think anytime that you start to experience any of those signs, that might be a really good time to go ahead and seek out care.
Okay.
And that could start off with just talking to a loved one or a trusted person around you. And just saying, hey, I'm noticing this in my life. I'm noticing I have less energy. I'm noticing that I don't feel motivated to do anything. And they can read back to you what you're experiencing. From
Okay.
there,
So it doesn't even have to be like a profession. It could be just somebody that you confide in, that you
I
can
would
talk
say
to.
for a lot of people, it starts off with the people who are around them. And sometimes the people who are around you will notice the changes in you before you do.
Hmm.
Um, so from that, I would say you can either go and you can speak with your doctor, you can speak with a mental health provider, you can. seek out a psychologist, a psychiatrist, a therapist. If there's a crisis situation, I always tell people you can reach out to 988.
Mm.
You can text or you can call 988. And they will be able to talk you through things. They'll be able to figure out like if it's an emergency situation and we need to get you to the hospital. Um, they will possibly set you up with a therapist or with a psychiatrist, and can move things along.
So is 988, would it be, is it a cost for that or is it a free service?
I believe 988 is free. I
Mhm.
believe so. Yeah.
And is it anonymous or can I just call in there? Like, do I have to be like, this is Christopher Marville and I'm living in, or can I just be like, I just need to get this off my chest? Like, can I just call if I just need to talk?
They are going to try to take some information for you, especially because it might be a crisis. And
Oh,
so if you're talking to this person, and for instance, if we had if we had somebody who was suicidal, for instance, if you called 998, they would want to know where you are and they would want to be able to make sure that they could get you the help that you need.
okay.
So they're going to take down some basic information. However, it's confidential. So that piece about anonymous
Yeah.
is still being represented there.
We love that. Yeah, we like that.
Yeah.
I think that's the biggest thing. Like one of the biggest fears people have with reaching out to help. That who else is this going to reach? I think that's the thing that plays in a lot of people's minds. Even in the work I do, people are like, "Who's going to see this? Who's going to?" I'm like, "Oh, this is just,"
Mhm.
and not even people, other people in the office get to see it. It's just like I take your paperwork and I do what it. It's nothing. People get that. There's stuff to be passed around. I think that's like the biggest
Yeah.
thing we have. And I'm like, no, we're not making stories about you passing around. We
No,
definitely, there are
no.
people are here to help. Yeah, people
Yeah.
are here to help.
And when you call 988, these are trained professionals. These are people who know about confidentiality. They know that they're not going to spread your information on the street.
That's beautiful. That's beautiful. This has been good stuff. So could you share an example of a mental health challenge? And maybe what some steps would be like to cope with it? Maybe just like a
Mhm.
basic.
So one of the things that I've been thinking about a lot, and I've been talking to a lot of people about since the pandemic, because we really learned a lot about this condition. So this is not a diagnosable like DSM. That's the book that therapists, psychologists, psychiatrists use. But it is a term that we have. It's burnout.
Mm,
So what we've kind of seen, especially during the pandemic, is that a lot of people were experiencing more stress, stress within their workplace, stress within their family life, and experiencing high levels of exhaustion.
mm,
Some of the symptoms might be feeling blue, feeling low energy, having a lack of motivation to do their daily tasks. And some of the
mm.
ways that we can,
I'm sorry, Tom.
yeah,
Would you mind
go ahead,
just pausing there and kind of like expanding on like what does like feeling blue mean? What does it feel? Because
feeling
I feel
blue.
like sometimes we have those days where it's like we don't
Yeah.
want to get out of bed, but is that like an alarm or is that like what I'm saying? Like what would be the level for that? Like when would it become like a little bit like, huh, this is concerning?
So, yeah. So with burnout, that's exactly what somebody would be feeling. They would
Mm,
be feeling like, ah, it's the morning. I really don't want to get to work today.
mhm,
I don't want to do that. Feeling blue might also feel like, you know what? I really used to enjoy this TV show. I don't care what happens next. This
mm,
used to be my favorite TV show and it doesn't matter to me anymore. It could also be, you know what? I feel numb to most of the things that are happening in my life. Um, it could also feel like a long-term sense of sadness. That would
mhm,
also be blueness. So burnout is not necessarily going to be like deep depression.
mhm.
It's a little bit less significant than depression, but it can lead into depression, especially if it's not taken care of.
Yeah, I just wanted
Does
to
that
give
answer the question?
it does. Yeah, I was just like, because some
Yeah.
people like I have people that talk to me like, oh yeah, I'm feeling a little sad today. I think I'm depressed. I'm like, are you sad just today, or are you like, are you having just a bad day? Because I think that sometimes those words get like interchanged. Like people use depression so much now. It's like
Sure.
I'm depressed. I'm depressed. And it's like, what do you? What does that mean for you? What is that? But it's
Exactly.
different for everybody else. It might look different for certain people.
Yeah, absolutely. And I think being able to ask that question of somebody that you're concerned about is a really great question. And then being able to ask that question about yourself is also really important. Am I am I feeling this today and I didn't feel this way yesterday or last week? Or is it no, consistently I don't want to get out of bed.
Hmm.
Consistently, like people are inviting me to go out and I don't want to. I don't feel like it, where normally I would.
Yeah,
Mhm.
yeah. Yeah, I think that's a yeah. We're in that. We're in the where we're all like you said in the pandemic. We were all working so hard, and then it was like a moment of a break for everybody. For
Yeah.
most people, I would say, because some people did still have to work at things. But yeah, you didn't notice like a shift in the culture almost, where people were kind of okay with diving into different hobbies and kind of like figuring out who we
Yeah.
are as a
Yeah.
person
Oh, absolutely.
at a time too. At that moment, yeah, yeah,
Yeah. A lot of people figured out ways to deal with the burnout. A lot of people figured out ways to deal with the stress of everything that was going on. 'Cause of course, it wasn't just work, it wasn't just family. There was, you know, there was social instability
mm,
with the protesting that was going on and the conversations that people were having. There was so much that was happening in the world at that time that wasn't just the virus that was moving around.
that was the least of people's worries. I feel like at certain times, like I think people forgot for a minute, like we were in pandemic for a reason. Yeah,
Yeah,
like we were here, but it was
yeah.
just so much piling up back to back to back on top of that. Yeah, yeah. I'm sure you guys were busy as therapists with people talking.
Yes, absolutely. Absolutely. And like we've talked about, a lot of people coming to therapy for the first time because of stress that normally they could deal with, and then just because of all the compounding of different stressors is too much.
Hmm.
It's too much.
Yeah, and I feel like I'm sorry, we're a little off topic, but yeah, I feel like when I first went to my therapy session, the way that it was always like portrayed on TV, I think I thought it was gonna be something different than it was, and I was just like, oh, like I feel like you had to have like one liners and like, but and my therapist is like, what do we have going on here? And I'm like, oh,
Yeah.
I didn't know what you wanted from me. They're like, no, this is not about it's about you. What do you want from this? And it's like, oh
Hmm.
snap. And that's the first question they ask
Yeah.
you, like, what do you want from this? I'm like, I don't know, to be happy. What
Yeah.
is that? And
Yeah.
I'm just like, oh, great. And that's when it all starts flowing. I feel like, yeah, once you get comfortable with your therapist, it all just like flows naturally.
Exactly.
Um,
Exactly. And I think that therapy can look like a lot of different things. And there are so many different modalities of therapy that really being able to think about, and I know that I need help. I know that I need some assistance with figuring some things out. I might not know exactly what I need to get there, but oftentimes you can definitely tell when it's not what you need. And so being able to communicate that is also really important because most therapists will be able to adapt to their clients that they're working with.
hmm, okay, good. So what would you say to those who feel like it's weak to go to therapy? And I'm not trying to get all soft by talking about my feelings. Like they don't want to, they're a big corn-fed person from wherever, and they're told to push it down and keep it moving. Like, how do you break through that for them? How do you let them know that it's for them? Like they're,
So I would say that sounds a lot like internalized stigma.
Mhm.
So I would also ask how well is it working for you to not talk about the things that are going on,
I know that's right. Okay.
right? Um, is not talking about things helping you to solve the issues, or is it further perpetuating the things that are already challenging? So if you've been doing things in this way, running on that rat wheel,
Mhm.
um, that's not working for you. So why not look out for somebody who is trained, has gone to school to actually start to help with some of those things? And I know that some people might feel as though it feels weak or it feels soft. Um, I would say engaging in therapy is about facing what's challenging and coming up with solutions.
Hmm.
That's not the definition of weakness. In fact, it is the definition of strength. Going to therapy takes courage because you're acknowledging that something is challenging and that you need help. It's also challenging to realize that you have been trying something on your own that has not been working for you, and that you need to find new skills to break out of old patterns to find something new that will work for you.
I like that. That is good. Yeah, because it's like you're here for a reason. Let us help you. Let's figure out what's going on.
Absolutely. Absolutely.
I love it. Yeah. Heck yeah. So then what are some misconceptions about mental health that we can debunk? Like
Mm.
what are some things that people come into with in therapy and it's like, blah blah blah. And then now you feel like, those are not they don't make sense anymore. They don't live for real.
Yeah. Yeah. Um, that it's a one size fits all experience. It's not. It's not. And I try to teach people to advocate for themselves. I try to teach clients that, you know what, I might not be a good fit for you. The next clinician might not be a good fit for you. That doesn't mean that therapy is not good for you.
Tyler, say that one more time, please. Because people really they meet one therapist and they're like, oh, we didn't click, so I quit. Say that one more time for them, please.
Yes. Yes. So it's important to understand that I might not be the right one for you. There might be another therapist that's out there who is going to be the perfect therapist for you. And that is not hurting my feelings.
Hmm.
It's a good thing. As a therapist, I want you to find the care that you need.
And then you don't have to be a black person going to a black therapist. You don't have to be a female going to a female.
Necessarily.
You don't
No,
have because there you can find somebody that meets you that might not be in that same. Yeah,
absolutely.
yeah.
Absolutely.
We get boxed in.
I Yeah, I mean, I can give personal examples of people who never thought that they would have a black therapist. They meet with me and it works for them. I have had, clients who thought that they could only work with a black therapist because a black therapist would get what they were talking about, and they met with that therapist and it didn't work. And that's, again, it's about advocating. It's about being able to figure out that, like, this is not working for me and I need to find out what will.
That is so true. Like I had my first therapist was like an older white woman. We had nothing in common out. Like I would say certain things and she would get to type in. I'm like, no, it was just a weird joke. I'm so sorry. Then I went through like
Mhm.
2 or 3 black therapists and I didn't connect. Now I have a therapist. She's a white lady. She's maybe like a few years older than me. And we are like she understands what I'm saying, certain things, like she
Yeah,
gets nuance, she understands. And I'm just like, look at me trying to stick, thinking I had to. Because again, I feel like some things are racially, like that connection,
sure.
but some things are also
Sure.
just culture. Some things are just like an age group, some things are generational, some things are
Yeah.
just you just find that person that clicks with you and it doesn't have to meet any of these criterias. And that goes for dating life also, not just therapy, okay. Yeah,
Um, there's
beautiful.
another thing in there too. I think that therapeutic rapport and therapeutic fit are what we talk about as therapists. And we can adjust things as needed. It is important for us to have kind of the background to know about things, and to be clear about this is something that I know about and we can work together on that. But ultimately, you are the expert of knowing yourself. So, like you said, some things are culture. I mean, where we are both people of the African diaspora, but your experience and my experience might not be exactly the same.
Mhm,
Somebody who's coming from Philadelphia might have a very different experience from somebody who lives in Tucson, Arizona.
mhm.
Might both be black, might both be male, but that doesn't necessarily mean that they're going to click.
Yeah. So you are not a monolith. exactly, Jamaica. We are not. Sometimes we think we are, but we are not. We all do not need a shade. That's one of them.
Um, Here's another misconception that I want to kind of like talk about, which is that therapy is only for white people.
Oh,
No. So another statistic. While only approximately 25% of Black Americans seek therapy, 40% of white Americans seek therapy. There are many therapists who are aware of the barriers that keep Black and Brown clients away from therapy and have sought their own training to be more culturally competent and sensitive.
okay,
Mhm.
okay.
Yeah. It doesn't mean that they're going to have the lived experience,
Hmm.
but they may know about things. And then as you talk, they have that like basic understanding to be able to continue to guide you.
Yeah, because with the work I do now, I help so many different people with so many different backgrounds that I thought I would never be able to connect with. And
Mhm.
it takes one thing to connect with somebody, literally
Well,
one small thing.
yeah,
And once you get that
yeah,
little connection, you're like, oh, okay, girl, I know you. So you're able to
right.
build that rapport after that. But yeah, that makes sense. I like that. And we know that they're being active in it. They're actually saying that there is some kind of, disproportion. They're like, let me do something about
Yeah,
that. We love that.
yeah.
Okay. So, Tyler, what does practicing self-care and prioritizing mental health look like?
Hmm.
I know it's different for everybody, but what are some of your go-tos?
Sure. And of course, self-care has really become one of those buzzwords, hasn't it? It's like entered pop culture, right?
Hmm.
Um, so a significant part of the work that I do with clients is about self-care and developing new ways to prioritize your mental health. Um, I like this idea. I was once taught that, like, as a therapist, you should work yourself out of a job. And what that means is that you should teach people how to do what it is that will help them to care for themselves so they can be reliant on the natural resources they have around them. I think that is a piece of self-care. So it's like being able to know that, like, I have friends, I have family members who are willing to talk to me about things. I could reach out to them. Um, I am, here's some other self-care things. I think about like the physical self-care pieces. So that's like, staying hydrated, eating healthy foods, getting sleep, having adequate shelter.
Mm,
Those are like the basics. We got to make sure that we have those things or try to have those things because it's really hard to work on the other parts of mental health without those basics.
yeah.
From there, um, you can find self-care through exercising regularly, spending time with friends, engaging in hobbies, resting, building new skills.
I like that. Yeah, and
Yeah.
then Jamaica also added whatever makes you feel joy.
Yes,
Whatever,
absolutely.
whatever
Absolutely.
you're gonna do that's gonna make
Yeah.
you the endorphins get up. That's gonna make you feel
Yeah.
yeah. In a
I
healthy,
once had
healthy way, non-harm reduction way. We'll say.
exactly, exactly. Yes. So I once had a client who said, uh, we were talking about self-care, and they said, well, what about if my self-care is spending time with my kids, playing with my kids? And I was like, do you enjoy it? And he said, yeah, I love spending time with my kids. I was like, then it's self-care. It doesn't
Yeah.
mean that it has to be something that you do by yourself.
Mhm,
You can do it with other people, but it's something, just like was said, it brings you joy.
mhm. For you, by you. Boo boo.
Mhm.
Mhm.
Yeah.
So,
Another, well, real quick, just another misconception about self-care is that because of the word, that it's selfish. I don't think it's selfish. I think it is about managing ourselves. And in fact, so that we're able to help manage the people who are around us as well. So the
mm,
example that I tend to give with my clients is if you think about being on an airplane, And when you're on an airplane, they tell you that if there's an emergency, the oxygen mask is going to fall from the ceiling and you've got to put it on. Well, they tell you something really critical. They say you've got to put that mask on yourself
Mhm.
before you start to help other people. And the way that I like to think about it is you put on that mask, you're now breathing some oxygen, and you can help the child who's next to you who can't reach it, and you can help the elderly person who's having trouble getting to it.
Mhm.
If you start helping the child or the elderly person who's next to you before you put on yours, you might pass out and you are no good to yourself. You are no good to that child, and you are no good to that other person who's sitting in the seat next to you.
Come
And all
on.
three of you are now in danger.
Mm-hmm. Come on. Yep.
So it's
Yep.
not selfish. It's about taking care of yourself so that you can take care of your community as well.
That's beautiful. I know that when I was taking the peer support specialist training, we had to do 20 hours of rap training after it. And it was just pretty much like a wellness recovery action plan. So like if something was
Mhm.
to happen to me, because I'm helping people, like if something happened to you, what do you need? How can we help you? So it's like it's so important. It's not selfish at all. It's a good thing to have. When you pour into so many other people, your cup does get empty. So you have to know how to replenish that cup. I think it's
Absolutely.
beautiful. It's beautiful.
Absolutely. Absolutely.
Uh, Thank you, Jamaica. Yeah, we cannot pour from an empty cup.
Mm-mm. No, we can't.
We live for helping, but we have to make sure we're taken care of. That's it. Like you can't
Mhm.
help somebody else if you are empty.
Nope.
So speaking of this beautifulness, how do we support friends or loved ones who may be struggling with with their mental health? So
Yeah.
like you can help by you can do the yeah.
Um, so I love that it's Men's Mental Health Awareness Month because I heard this recently. One of the things that you can do that's really simple, but also very crucial, is to just check on people. Just think about for this instance, think about the men that are in your life and reach out. One of the things that we know about men, for instance, who are socialized in this country, is that we often don't reach out to other men, and we don't often talk about the things that are really, really important. That's not everyone, of course, but a lot of men who are socialized in this country, that is the way that they have been socialized. And so there's a lot of loneliness that's going on. And so one of the very simple things is just calling people up and saying, "Hey, how are you doing?" Or even like calling somebody up and saying, "Hey, would you like to go and do something together?"
Mm, mhm.
I had this experience when I was younger where I reached out to a family member and I knew that that family member was going through some stuff. And so I reached out to them. They were younger than me. And I just wanted to take them to the movies. Their father was also going through some stuff and ended up asking me, "Can I come along with you?" And that's when it keyed in for me. Gotta check on you too. So simply doing something with someone is a way that we can show that we love the people who are in our lives, that we care about them, that we want to know what's going on, that we want to know what they might be struggling with.
Yeah, and
And
that
it's simple.
call or that checking in, it can really help somebody. You just never know
Yeah.
somebody's going through, and that one phone call could just brighten up their day. It could just like, oh, okay, somebody does care. It lets them know that that is very important. Yeah, and like you said, like even I like to do my check-ins in person. That way, because you can lie over text message. You can like
Oh yeah.
boom, you can do that over text message. But like somebody that you love and care about, getting them in front of you, I'm like, what's going on? Or let me like, how are you doing? How are you feeling? You can tell by their face, the way they talking. Yeah, just getting that one on one.
Yeah.
Let's see. Oh, we have a Q and A.
Okay.
We have an answer. Here, check on people who you think got it together or who are labeled as strong. That's
Oh
good.
yes.
Yeah.
Yeah. Yeah, the folks who are strong, they are often like they're perceived as taking care of other people, which sometimes means that they're not doing a very good job at taking care of themselves.
Hmm.
And people get into roles with other family members and friends of like, I'm the one who always cooks, or I'm the one who always, you know, checks in on people.
Hmm.
Who's checking in on them?
Hmm. Hmm. Yeah, I think when I had my mental health issues, that was like a cycle that I found myself in. Because I'm usually the one that like my friends come to like talk to about their issues and blah blah
Mhm.
blah. And then like what was going through my stuff, I was like, can I talk to people? Because it was like because you're like in this mind thing of
Yeah.
like, if I start reaching out and asking for help, then are they gonna think that I'm like weak, like or I don't want like they're gonna start thinking like, do I not have it together
Mhm.
anymore? Will they come to me? Like your brain goes through all these things and it's like, man, if you don't let people know that you're going through some stuff, and some acting like,
Yeah.
oh, I'm okay, I'm fine, everything's
Yeah.
fine, everything's fine. But the ones that know you, they know. They can see through the
Yeah, they know.
facade. They're
Yeah.
like,
Yeah.
all right, yeah, I hear you, Mrs. Fine. Yeah, yep. Bring food. Check on the quiet ones, definitely. Bring food,
Mhm.
a drink, a
Mhm.
listening ear. Think I was just king up her. Yep. And then another thing, people don't want to share their information because don't nobody wants to be a TikTok story. Jamaica says it's in the current
Okay.
climate with people, it's hard because people want to get clout. Yeah, nobody wants to be turned into a 9-part TikTok story. So I told you my
Yep.
business, you know what I'm saying?
Yep.
Yeah, that's beautiful.
Mhm.
So what does mindfulness mean? And what role does it play in mental well-being? Would you
Yeah.
say?
Again, another buzzword. But the basics of mindfulness is being aware, being engaged, and being fully present. Um, so there's this one example that I'll teach a lot of my clients about, and it's this idea of when was the last time that you took a shower and just took a shower? And most people will look at me kind of funny and they'll be like, wait, what?
Mhm.
And so most people, when they're in the shower, they are thinking about their grocery list. They are
Mhm.
thinking about all the things they did that day or all the things that they're about to do that day. They are sometimes going over all of the grievances of all the relationships in their life.
The little
You know
shower
what I'm
art.
talking about?
Who
Yep.
said this? I
Right.
should have did that. Yeah.
Right. And so a mindful way of taking a shower would be to simply be in the shower, enjoy the water, enjoy the heat of the water, enjoy the soap and what it smells like and what it feels like, and really allowing your senses to be open and present. And if you notice that some of those thoughts are starting to creep in, you're starting to kind of say, oh, well, later I've got to do this. You just say, when I get out of the shower, I'll take care of that. But right now, I'm just taking a shower. So that's mindfulness. It's being present. And so it can be in those simple moments like showering, or it can even be when you're communicating to somebody. Instead of like thinking about the next thing that you want to say, you simply listen and you respond to what the person is saying,
Mhm.
not the point that you want to get across.
Mhm. That's beautiful. So that shower could
Mhm.
also be like your self-care moment. It could be your
It
mindfulness
could
and
be.
self-care moment in moment. Like you're taking the
It could
time to
be.
like, yeah, checking with yourself. Like you said, like
Absolutely.
yes, I love that.
Yeah.
That.
Yeah. Yeah.
Thank you. Okay.
I think of mindfulness as like moments that we can actually kind of like take back from ourselves for ourselves.
Okay. Very nice. Yeah, I never thought about it like that. I like that. Someone added it. The showers always like a reset for them. They love the water as a reset.
Mm.
Mhm.
It's a great self-care tool to use. It's a way to like kind of put it into your routine, but it's also a great way to cope with stress. You could have a really stressful day and you could say, you know what? I have got that really nice soap that I just bought, and I will just take some time and just kind of like scrub it away.
Little candles, some little aromatics going. Yeah, yeah, yeah. Okay, I
Yep,
like it. I like it.
yep,
Okay.
yep, yep.
All right. Um, how can one reduce stress and maintain whole health for a better mental health?
Yeah. So this question again goes back to self-care and it goes back to coping skills. We can reduce stress by engaging in regular self-care routines. Um, you might think about like those showers, for instance.
Hmm.
So maybe it is that like you find a favorite soap or you find a favorite candle, and that becomes part of your routine. And so now it's even more relaxing than your just typical shower. I'm getting clean, I'm hopping into the next thing.
Hmm.
So that can be part of your self-care. Um, I also kind of like to tell people you can think of self-care as like a prescription for life.
Mm.
So it's all the little things that you would do to make yourself feel better, to make yourself feel joyful, to give moments back to yourself. If the world is taking so much from you, work, family, all the different responsibilities, this is something that you get for yourself.
Very nice. Very nice. I love that. Take back your self autonomy. It's for you.
Mhm.
Take care. Um,
Some other examples might be like going for a walk when you're feeling stressed, instead of lighting up a cigarette or vaping.
mhm.
Um, calling a friend when we feel stressed and instead of engaging in stress eating. Yeah,
So just replacing tri- unhealthy triggers with healthier triggers, like making
exactly.
sure that you're replacing it for your food.
Exactly.
Okay, this came in. So how do you keep your mind on the present and not jump to all things on your to-do list? I guess just go back to like when you're in the shower and trying to like get into like how do you make sure that you're staying on track? Because our minds will hop around.
Mhm. They will. No, it's actually very natural for our brain to hop around. I tell people all the time, like your brain is designed to think, and your brain is designed to think about as many outcomes as possible. So it's gonna hop around a lot.
Yeah.
And that's okay. We're not really like fighting it. We're just acknowledging that that is there, and then we're coming back to the thing that we're doing. So if it was the shower, like something I would suggest would be like thinking about the temperature of the water. So noticing like, oh, does this feel warm? Is it cold? Is it too hot? Like, how does that feel to me? I'm like smelling the soap. I've got like a coconut soap that I use. And so
Mhm.
noticing like what that smells like and then noticing what it feels like. Um, looking at it even and just noticing what color it is. I mean, those are all going to bring you back to the present. And I think that one of the best ways to think about it is using your senses, using
So
all
the
five
grounding,
senses
yeah, go
to
back to
ground yourself back.
yeah,
Mhm.
okay, very
Yeah,
nice. Let's
yeah.
be a little shopping. Yeah, cooking, calling a friend, reconfiguring
Mhm.
your circle. Who are around you? Yeah, some people we don't
Yeah,
have. We don't have people we can. Some people don't have people we can trust that we can call and talk to stuff about because it
yeah.
starts with gossip tree. So that's a big good point. Make sure you have a trustworthy circle.
And I think you'll notice oftentimes when I talk about who to talk about, I talk about finding somebody who's trustworthy
Hmm. Hmm.
because there's a lot of people who will listen, but they're gonna gab right afterwards.
That phone tree gets started. Girl, did you know
Yeah,
about? Did you hear about?
yeah,
And
yeah.
then
We're
that
not
sets
we're
you
not
back.
looking for that.
No, we're not.
No.
You're not helping the situation at this point.
Yeah.
Okay. So, what resources or tools are readily accessible and are helpful in managing your mental health?
So for a lot of us, we've got a lot of technology around us, which can sometimes be a problem. But in this case, it can also be something that's helpful. Phones, computers, and tablets can easily be used to access meditation apps, and meditation websites. There are a number of meditation exercises that are on YouTube that are free. You can find ones that are a minute long. You can find ones that are 5 minutes long. You can even find things that are like virtual reality so that you are able to like listen and hear and see all at the same time. Some other resources might include journaling, engaging in therapy, or talking to trusted family members or friends.
Mhm. And I
Yeah.
think we used before we even got on recording yoga.
Yeah.
Yoga is a big yoga for me was a big lifesaver. Just the meditation, the playing of this, the singing bowl, the grounding. A lot of the yoga practices and therapy practices kind of like overlap, especially with the
Mhm.
grounding and the breathing and stuff like that. Breathing, you can do that anywhere. You can breathe anywhere. You can
Breathing
ground.
exercises.
Yeah.
Yep.
I wear a lot
Yeah.
of necklaces and beads. That helps me with my grounding to bring me back into
Yeah. To have some. Yeah.
just to have that, that texture. So yeah, it's on you. But it's like it's in you, it's not on you. So I feel like yeah, that can be anywhere you need that. That take the triangle or the square breathing can be done in your car on the way to work.
Hmm.
In the
Hmm.
traffic, you're just like, when I get through this, that's when to make it like yeah. Those practices can be used throughout.
I always tell my clients that like breathing exercises are like one of the best things because you can do them anywhere,
Mhm.
anytime, and you can even be like stealthy in the way that you use them because like you could be doing breathing exercises in a meeting and nobody knows what you're doing. You
Yeah,
don't have to close your eyes. You can have your eyes open while you're doing it.
my body kicks into that. Like when I get mad nowadays, I'm like, am I okay? Let me calm myself down. Let me self-soothing.
Yeah,
Yeah,
exactly.
I used to live right there.
Exactly.
But yeah,
Yeah.
okay. So within a community of approach, because here at Seeds of Healing are about giving back to the community, make sure we're feeding the community. We want to know how can we create a supportive environment for those dealing with mental health challenges here at Seeds.
Mhm. I
I mean,
think it starts with
in your
having
house.
compassion. Yeah. Yeah. Um, I also think like being able to build family and friend practices of open communication. When you've learned skills about how to communicate well, teach that to other people so
Mm,
that they can also communicate well. Um, Developing stress reducing community activities like yoga, meditation, exercise, forums to talk about mental health, talking about mental health in our community and our spiritual centers. Um, we were talking earlier about religiosity being one thing that can kind of go either way. And I think that bringing mental health into religious spaces and spiritual spaces can actually be very helpful because now you have the support of faith along with the support of mental health in the same space. You're connecting them together.
okay.
Um, Another thing that I think can be kind of helpful is supporting legislation that assists people who are struggling with mental health. Um, mhm. So thinking about, being able to build psychiatric hospitals, especially in places where there aren't any or there is not a lot of care. There's plenty of places in North Carolina where there is not a hospital 30
Correct.
minutes in either direction,
Yeah.
and especially when it comes to psychiatric care, we don't have many of those. Um, Again, with legislation, you can also look at grants. You can look at there's programs and there's even some programs here in Wake County in Raleigh about culturally informed law enforcement. So these are like teams that are placed on in police departments that are made up of peer support individuals who are made up of therapists, social workers, different mental health professionals. So when you know that someone is experiencing a mental health crisis, you don't send out a police officer to go to that home. You send out somebody who is very well trained to go out to that home. There might be somebody to support, but we want to de-escalate those situations. We don't actually want them to get worse because the officer is now there. And we talked about this earlier about like what are the things that we need in order to be able to self-care. So being able to support affordable housing is a really, really big issue as it relates to mental health. And that's also something that we've got to address.
Yeah, that's a big thing. Yeah, we went to Congress with Age United earlier in March, and that was like Medicaid funding for Y and Y. Like these things were a big thing Because when people have, like you said earlier, when people have shelter over their head, a nice home to go to, like when they have supporting other things, it makes their mental health situation easier. A
Yep.
primary care doctor, if you're not stressing about all these other things, medication, if you don't have to stress about this stuff, it makes your other things in life a little bit easier for you. Yeah.
And we know of different physical conditions that you even need to have refrigeration in order to be able to take your medication. So if you don't have stable housing,
Mhm.
there is no way that you can manage those conditions.
Yeah.
So it's, I mean, affordable housing is like almost like a holistic approach to so many other mental health and physical health
And
issues.
yes, it would help with a lot of things people are going through for sure. For sure. Yes. Tyler, it has been a complete pleasure talking to you tonight. I really, really
Yeah.
appreciate this conversation, the openness. I think it's been very, very helpful.
Thank you so much for this opportunity. I'm glad that we were able to talk about this and
Of
get out
course.
some more awareness.
Yes, that's what we need. People need to know that it is okay. So if you had any um, I guess things you want to leave the people with tonight, what would it be? Like what would be like your biggest stand when it comes to Black men, mental health, just the LGBT, like anything that you like want to leave our people with tonight?
To treat people kindly, number one, to have compassion, to check in on people, like we said earlier, to know that therapy and mental health is not just for one section of the population, that it's really it's for everyone. Because we're all journeying through life and we can always use some new skills on how to get through it.
Hmm.
So I think those are my big things that I want to
Those are
teach people.
yeah,
Yeah.
those are awesome. Those are great. Those are great. Okay, again, thank you, Tyler. Also, guys, we encourage. Oh, so I want to thank Tyler for being here. Thanks for the conversation. Thank you guys for all watching. We would like to encourage everyone to sign up for Showtime. Follow us on Facebook and Instagram for updates on upcoming webinars, and join our mailing list for mailing for future updates. So, thank you guys again. Thank you, Tyler. Thank you, A New You Counseling, for bringing over Tyler. Thank you, Seeds of Healing, and have a great night, everybody.